Now we're going to look at the 20th century in Objective 5. We're going to finish up on our history of neuroscience discussion and bring us up to close to the present, where we're going to see how in the latter half of the 20th century, a revolution in imaging made it possible for us to understand human neuroscience, especially in a brand new way, and along with something we're going to talk about later on, which is a revolution in molecular biological techniques that allowed us to understand neurons as cells at the cellular and molecular level in a lot better way. And these two things are going to come together. But right now, we're going to talk about human neuroscience and the imaging revolution. So up until the 1970s, 1980s, surprisingly late, during the time that I was training, and if you're a typical college student during your grandparents' lifetime, there was this huge innovation that most people were completely unaware of in terms of being able to image the brain. Up until that time, if you had a traumatic brain injury, for example, you could look for a skull fracture with an X-ray, but that's all you could do. You could just see something really, really horrible had gone wrong, and you could probably see a skull fracture by the blood and the bone that were on the outside of the patient more easily than you could by doing an X-ray. And so it was a really useless technique, is X-raying the brain and trying to look at the structure of the brain with an X-ray. Similarly, if we wanted to be able to see the brain, for example, we would do something called pneumoencephalography, where we would inject air into the ventricles, the fluid-filled spaces of the brain, and put an air bubble in there, and then rack the patient around in different positions and have that bubble go to different places and visualize the bubble as it went around. That's a pretty horrible way to treat your patient, and the patients were in a great deal of pain from this air bubble. It stimulated nerve endings and caused a great deal of pain, and it didn't give you a very good view of the brain anyway, but that was all we had. Okay, we could inject similarly a radio contrast dye and rack the patient around and have the dye float up or sink down to various parts of the nervous system, but again, not very satisfying in terms of helping patients very much. And then with advances in computer technology, somebody got the clever idea of shooting X-rays from a whole bunch of different directions, but a lower dose X-ray so that it interacted more with the brain tissue, because the problem with X-rays is that they're so fast, they're so energetic that they don't stop to interact with brain tissues like they do with bone, which is why you can see bone a lot better than brain on X-rays. But if we use a low dose X-ray, then that X-ray is going to interact more with the brain tissue, and then rotate that low dose X-ray around in a 360-degree circle, and also changing the angle of it, and then using computers to put together those low-dose X-rays into a series of two-dimensional representations that makes a three-dimensional image of the brain. And this is called computed because it uses computers. Tomo is slicing, graphy is making a physical record of something. So this is making a record of slices using a computer or computed tomography, CAT or CT scanning. And then we had, even a little bit later, adapted a technique from organic chemistry called magnetic resonance or nuclear magnetic resonance, to using being able to look at the water in the brain, because NMR, it turns out, is really good at detecting water molecules, and so we could look at the water content of the brain. It turns out the water content of the brain to a large extent correlates with the function of the brain. The axons that are carrying brain information, the white matter that you see when you cut into the brain has less water than the neurons themselves. And of course, the vascular spaces have a lot of water, and so you can see all of these things with magnetic resonance imaging. Why don't we call it nuclear magnetic resonance anymore? Well, I was around for this. It turned out that patients really, really resisted having nuclear, they would call it, not nuclear, but nuclear, things done to their brain, okay? And so even though this was not harmful to anyone's brain, and I've had it done to my brain, as we're going to see a few times, And as far as I know, it hasn't caused any harm. There's still a lot of worry because of the word nuclear, so we just wiped the whole nuclear word out of it. We were referring, in this case, not to like a nuclear fission or nuclear fusion, but rather the nuclei of atoms that we're looking at the resonance of, that we're looking at the vibration of under the influence of a very large magnet. So we can look at the changes in blood flow, because blood flow is water flow, because blood is mostly water, and so we can see the blood flowing in different places with something called functional magnetic resonance imaging. It turns out that the brain has, and other tissues of the body as well, have this really neat characteristic. For example, if you need to run away from tigers, then you direct a lot of blood to your muscles that are needed to run away from tigers. If you need to do a math problem, then you direct a lot of blood to the areas of the brain that are needed for the math problem. So whenever a part of the body is starved for energy, it actually asks for more blood flow to come into it. This is through a series of what are called precapillary sphincters that open up the capillary bed and allow more glucose and oxygen to flow into areas of the brain that are more metabolically active. Here in this functional MRI, we can see the location of the lateral geniculate nucleus, and we can see the location of Brodmann 17, which is what we're calling primary visual cortex back here. Well, here's somebody that should be familiar. This is my brain doing math. So as I said, I've been inside the MRI too. So now we're looking at a picture of my brain. This is the best selfie I ever took. I use it on my LinkedIn profile, for example, because it's a really good angle of me. I mean, it's really my best look, I think, using my brain in this way, doing math problems. So these are the parts of my brain that are more active when doing math problems than when I'm doing something else, when I'm doing a control problem. And in this case, the control problems were hard math problems versus easy math problems. And what makes the difference between a hard math problem and an easy math problem? Well, when you're in an MRI tube and there's lots of bang noises going on and a high-pitched hum, and your water molecules are being picked up by a magnet and then dropped suddenly, and you're listening, the machine is listening to the vibration of your water molecules in your brain. That's just a really, really weird circumstance. I don't know if anybody's ever had an MRI, but it's not conducive to doing math problems of any sort. So it turned out that the hard math problems are those that require a carry task. So you can do 7 plus 9, you can do 3 plus 4, but can you do 37 plus 49 is the question, because that requires a carry task. And so when we do that carry task, this is the part of the brain that's lit up in people, including me, when we're doing a math problem in our head, because we can't bring a calculator into the MRI machine; it would be destroyed by it. Well, it turns out that people with depression have changes in the metabolism in their brain as well. And so this is looking at, we'll look at depression in the next slide. I misspoke. This one is obsessive compulsive disorder. Obsessive compulsive disorder, turns out we've known for about 20 years, is an imbalance in activity in an area of the brain that we'll learn about later called the caudate nucleus. You can look it up now in the textbook if you want to, using the search function. But the caudate nucleus is asymmetrically active in obsessive compulsive disorder. And if you use a drug which is known to work and help with the symptoms of obsessive compulsive disorder, wait for it, it actually changes the activity of the brain in obsessive compulsive disorder. So when you give this, Paxil is the name of this drug, paroxetine is the generic name, it turns out that it alters the metabolism of glucose in obsessive compulsive disorder and brings the two caudate nuclei more into line with one another, so that there's not that imbalance in activity which is characteristic of this disease or this brain condition. It's not really a disease in my way of thinking. And similarly, the same drug is also altering glucose metabolism, but in different areas in patients that have major depression. So it's not just that this drug is altering a particular pathway or altering activity in one area. It's actually treating the illness or treating the underlying brain dysfunction, or the way in which the brain is working differently between people with OCD and people with depression react differently to the same drug. We can see that not just in their behavior, but also what happens as we image their brains with a functional MRI.